Hi, I'm Dr. Ravi Teja Rudraraju, complex knee and sports medicine surgeon at Apollo Jubilee Hills. Today we have Mr. Timoe with us. He's from Fiji. He traveled all the way from Fiji to India to get his knee problem fixed. I'll just walk you through what happened to him. Mr. Timoe had an injury while playing soccer back in his country, and unfortunately, he sustained a multi-ligamentous knee injury, which is an ACL tear with a PCL tear as well as with a lateral collateral ligament injury. There were few injuries to his patella as well as to his meniscus as well. So when we examined him initially, obviously he contacted me before coming to India. I saw his MRI reports and definitely understood that it's a definite complex injury that we have to fix. We made sure that we explained in detail of what needs to be done to him. Then believing us, he flew all the way from Fiji to India. After coming here, I examined him personally. I saw his knee, I examined his knee, and definitely anterior drawer test was positive, which is characteristic of an ACL tear. Although there was no significant posterior drawer test positive, which indicates a PCL tear, but I have explained him that he might have a PCL injury. And we had an MRI again, and in the MRI it showed that the ACL was completely torn and there was a partial injury to his posterior cruciate ligament, and there were a few changes in his meniscus and there was chondral damage to the patella. Overall, I walked him through what needs to be done because he's a soccer player and an army personnel in his own country. Also, his personality is well built. He's got a very good physique, and it's important for me to put him back onto the court or the ground once he is recovered. So I explained him that I would help you recover well and then also put you back onto the field in 1 year time from now. So believing me, he agreed to undergo an arthroscopic ACL reconstruction with plus or minus PCL reconstruction and meniscal repair. So I planned the surgery with an intention to definitely fix ACL, but also to fix PCL and other things which were needed intraoperatively, whichever needs attention. So we used his hamstring tendons and reconstructed a complete ACL for him with an all-inside technique, preserving the bone as well as utilizing less of his tendons. To his luck, his posterior cruciate ligament was not completely torn. So although there was slightly damage to his PCL, but he didn't require a PCL reconstruction. And definitely his meniscus was a bit torn, so I had to do a partial meniscectomy, and his patella had a wear, so I had to do a patellar chondroplasty. Overall, I was very happy with the way that his surgery went through, and after the surgery also, the first for 1 and 2 days he was very comfortable. He was very much pain free because of the blocks from our anesthetic team, and now he is with us after 2 weeks. He had his sutures removed, and his wound is absolutely dry and clean. Very happy to see him with his happy smiling face with no pain and very comfortable position now, and I'm looking forward to have a wonderful recovery in the coming weeks too.
Thanks, Doc. First of all, I'd like to thank you for really looking into my case. It was a very mind-opening experience for myself. First time coming over to India and experiencing all this. I mean, the people, the place, it's very foreign for me. Fiji is a small place. I didn't know that I was gonna end up here. But through our medicals came from the army, they actually told me it was a good place. So at first, at the start, I was like a bit, because I wasn't so sure. So when I arrived, first day, you just told me everything, and then meeting you, planning out everything from the time that I was gonna go in, through the operation, and coming out. And now I'm on recovery mode. I'm really happy that everything was very sufficient. It was high quality and very effective, especially the time. It wasn't really that long. It didn't take that long. For me, experiencing this was really something for me to take back to Fiji. And I would really say that it's one of the top quality places to go to. Going through physio now, that's my last stage. So going back to Fiji, I would really take back whatever I've come to see here. Like, I've learned so much.
In case if you guys need any help from Fiji, we are always there to help you from
Thank
Apollo and as well as from our doctor's team. It's a
Okay.
great pleasure meeting you and also treating you. So all the best.
Thank
We'll
you.
catch up again.
Pinakapaliw.
Thank you.